This is a slideshow recently put together by the staff at Muskegon Family Care in order to provide you with an overview of what we do at our organization. What is an FQHC? An FQHC is a federally qualified health center. The Bureau of Primary Health Care wants to ensure that the underserved and vulnerable receive the health care they need. One way they do that is by funding federally qualified health centers. We are eligible for cost-based reimbursement from Medicare and Medicaid, as well as grant funding. What is Muskegon Family Care? We are a healthcare organization that began doing business as Muskegon Family Care in November of 2000. As a federally qualified health center, we are independent from the hospital, with our own governing board of directors, organizational policies, employees, and finances. This is our board of directors. Ms. Clara Shepard is currently our board president. As a requirement of being a federally qualified health center, over 50% of our board members are patients of Muskegon Family Care. Over the next few minutes, this slideshow will visit each of our sites and highlight some of our programs. This includes visiting our Getty Street Clinic, our Oak Avenue Health Clinic, which includes our residency program, our dental clinic, our family planning clinic, and our community outreach through our maternal infant health program. The people we serve include a wide range of ages, from pregnant women and children to the elderly. Our patient population is culturally diverse. Some of our patients have commercial insurances, but most of our patients are the underserved, including Medicare and Medicaid, and the uninsured. Our patients come from a wide area, but primarily live in the cities of Muskegon and Muskegon Heights. We are approximately a $9 million organization. Our mission and values are at the heart of what we do. Our mission is to promote the physical, emotional, and spiritual health of families through our healthcare and other supportive services. Our values are caring, access, respect, education, and success. First, we'll go to our Oak Avenue Clinic. Our health center is located on the 4th floor of Muskegon General Hospital. This is adjacent to the Special Delivery Birth Center. The health clinic and the family practice residency program started simultaneously in 1989. During their time with us, the residents follow an increasingly complex mix of patients. The clinic was previously located in a very small office behind the hospital. It moved to the remodeled 4th floor in the spring of 2001. We now have 20 exam rooms and a much greater capacity for seeing patients. Our providers include physicians, mid-level providers, and behavioral health providers. Dr. Catherine Keller is the Family Practice Residency Director. Bill Phillips is one of our physicians and is also the Assistant Residency Director. Our mid-level providers include Jennifer, Bethany, and we are also served by Dr. David Wilson. Joe Bauma and Joel Engel are counselors at the Oak Clinic. We now go from the 4th floor down to the lower level where the dental clinic is located. The dental clinic opened there in December of 2000 with 6 operatories, and we expanded to 10 operatories in April of 2006 because of the very high demand for dental care. In addition to regular business hours, they also see patients during emergency hours. Dr. Amy is our dental director. The staff includes full and part-time dentists, as well as support personnel. Paula Podine is our dental and billing manager. Across the parking lot, we move on to our family planning clinic, where Lynn King is our primary provider. The clinic began operating as part of Muskegon Family Care in October of 2007. Because another local family planning clinic closed soon after we assumed operation of our family planning clinic, we are working to expand the access and exposure of the clinic. We are also opening a family planning clinic site within Muskegon Community College. Both sites offer many services around family planning, including confidential teen health services for men and women. We now go to the clinic at Getty Street. The clinic used to be located at 2345 South Getty Street, which has always had a history of being a family medical practice with a continued mission to treat the uninsured and underserved. It was built at its original site by Dr. Dale Williams in 1973, next to the low-income housing projects. It was called Koinonia Medical Center, which is Greek for fellowship or helping one another. At one time, the clinic was open 24 hours a day. It struggled financially, and at one time the staff worked without pay in order to keep the clinic doors open. Andrina is the lab technician who has been with us since the building was built in 1973. The Koinonia Clinic was purchased by Mercy General Health Partners and eventually joined the Oak Clinic to become Muskegon Family Care. The Getty Clinic is now housed on the corner of Hackley and Getty at 2201 South Getty Street. The state-of-the-art healthcare facility was built with the support of generous donors in the community in 2005 and opened its doors on July 27 of that year. There are now 30 exam rooms, which are staffed by physicians and mid-level providers. Bill Ulrich is a physician's assistant who has been with the clinic over 30 years. In 1999, he was named National Inner-City PA of the Year. Dr. Maureen Street is our medical director. Dr. Sharon Christian and Dr. Aaron Huizinga are physicians. Our mid-level providers, in addition to Bill Ulrich, include Nicole Bradford, Margaret Walter, Kathleen Robinson, and Amber Schull. Dr. Sprague is an internist who also works with us part-time. Our behavioral health counselors include Ann Wilson and Tammy Grossens. Also housed in the Getty Street Clinic is our maternal infant health program. They do primarily home visits for women who are poor and underserved. This program is particularly important for us because of the rising disparity of infant mortality in our community. The maternal infant health program provides outreach through nurses, social workers, and dietitians. Also found here at Getty is our billing staff. And in addition, our full-service pharmacy is located right off the lobby of the Getty Street Clinic, with walk-in and drive-through services. The prices are low cost for all patients. However, this is not your ordinary discount pharmacy store. Dr. Paul Schultz offers his clinical expertise as our pharmacist by overseeing the pharmacy, as well as offering medication reviews and educational sessions with patients on an individual basis. You will also find the office for our information system staff at our Getty Clinic. However, they are our technical gurus for all of our sites. Our administrative offices are housed at the Getty Clinic as well. This is our executive director, Donna Littlejohn. She has been a remarkable asset to Muskegon Family Care as she has moved the clinic forward in strategic planning, building a strong fund development and capital building campaign, engaging the community, and establishing new collaborative partnerships. Terry Kahn is our Director of Operations. Gwen Williams is our Director of Community Services and also serves as a part-time therapist. Sheila Bridges heads up our Human Resources Department. Cassandra Palenko is our Training Coordinator and Safety Officer, and Benny Chambers works as an assistant to our administrative staff, along with Karen Broughton. Lynn Diffel is our Chief Financial Officer. Carol Linderman and Lori Stafford handle our accounts. We'll now briefly highlight some of our programs and services. Muskegon Family Care is one of the few health centers to treat Muskegon Care patients. These patients are part of the Old State Medical Program. They often come with a lot of physical and psychosocial needs. We have a protocol to diagnose and treat children who may have attention deficit hyperactivity disorder. We also have behavioral health services available on site. That means patients can see a counselor right at their health center. We have full-time and part-time staff at both clinics. The staff participates in numerous outreach events. Some of the events are traditional, like adopting families at Christmas time. Other activities are less traditional, like our annual mammogram party conducted in May each year for women at risk for breast cancer, or the ice cream social and other activities during Health Center Week in August. Other charity work includes ongoing special collections for patients in extreme need. The staff also participates in community programs such as the Children's Program at the Christian Community Center, supplying candy for their annual Halloween and Easter parties. Each clinic has a counselor on site to assist patients with social needs and problem solving. The staff also participates in community collaboration. This could mean serving on committees, participating in the Women's Cancer Screening Program, or providing physicals for foster grandparents. Muskegon Family Care also uses electronic medical records to better serve our patients' needs more efficiently. We also offer a program for fathers and children called Dad's Always on Duty. This is offered quarterly and is free to non-custodial fathers. It's taught by a parent educator and a family practice resident. The staff regularly donates money to a small emergency needs fund. This could be used for any patient need from a new winter coat to medicine they can't otherwise afford. If a patient does not speak English, interpreter services are available. We also have staff on hand who speak fluent Spanish. We also help many patients with medication assistance. This could include our 340B pharmaceutical program, which allows them to purchase many of their meds at a discount. We also help them occasionally with samples, accessing other community resources, and we assist them in locating medications through the pharmaceutical companies. We are also a screening site for several vision programs, including a national vision program and the local Lions Club program, which provides eye exams and glasses to children without vision insurance. Our organization has a sliding fee scale so that no one is turned away because of inability to pay. We participate in many grants, including a recent grant to improve diabetic care in the community. Transportation is available to our patients on a first-come, first-served basis, offered by our van driver, Ken. We also use volunteers, including AmeriCorps volunteers and the foster grandparents who help care for children in our clinic lobby. As we conclude here, we'll mention a few things about our vision for the future. There are many challenges in caring for a population with great needs. There are a lot of opportunities and obligations that come with being a federally qualified health center. We continue to look for opportunities to collaborate with other agencies and to seek out grants to better serve our patients' needs. There is a great need to increase our capacity at the dental clinic, and we are currently working with the local dental coalition and volunteer dentists to meet the dental needs of our community. And we always return to the fact that we want to honor our patients, our mission and values, as we continue to serve the poor and underserved in our communities.
Hi, I'm Donna Littlejohn, the Executive Director of Muskegon Family Care. Thank you for taking time to view our presentation. Our work here at Muskegon Family Care is much needed and very important to all of us. This is our story, and we have high hopes for the next chapter to expand our access and services to the community. So far, we have a bright start with a generous donation from the Koinonia Foundation, which we will be using to open a new facility next to our Getty Street location in the very near future. If you are thinking of joining us as an associate or thinking of helping us financially, we are most grateful, and we thank you in advance. I would like to give a special final thank you to our staff, donors, volunteers, and board of directors, and most especially, I would like to thank our patients for entrusting us with their personal health care.